Newsfirst Newsline with Faraz Shauketaly.
And a very good evening to you and welcome to Newsline Live. We are broadcasting from the Newsfirst studios in Dorset Street in Colombo on what turns out to be a rather wet day. Now then, this evening, with all the talk about the vaccine availability and the licensing issues, and in the United States already the vaccines are on its way to the different states and so on, we thought we'd speak to somebody who knows a thing or two about vaccines this evening, and let's see where Sri Lanka stands at the moment. And he's none other than the formerly Sri Lanka's chief epidemiologist, Dr. Nihal Abeysinghe. Very good evening to you, Doctor.
Good evening, Faraz.
Doctor, before we start all this, you also had a role to do with vaccines and so on for the UN, the WHO. What was that?
Yes, Faraz. From 2008 to 2016, I was in New Delhi in the WHO regional office, and I was first 2 years I was the medical officer for new vaccine introduction, and for the rest of the 6 years I was the regional advisor, vaccine preventable disease for this Southeast Asia region.
I see. Very big responsibility, no doubt.
Certainly, yes.
And your 8-year stay in Delhi was how? How do you rate that?
Oh, it was very pleasant. It was almost like Colombo, so I didn't feel any difference.
Oh, right, good. Now then, we have, Doctor, obviously the information that in the United States the trucks have already started delivering and pushing forward these vaccines to all the states, and the UK has, and in the US, the FDA, the Federal Drug Agency, the regulator, has given permission for emergency use of this for 16-year-olds and above. The United Kingdom have done the same. India has more or less done the same, and Singapore's done the same. So what of tiny little us here? What are we doing?
Okay, for us that now Sri Lanka, we are discussing within the Ministry of Health. I mean, I supported the most of the discussions, and now there is a facility called COVAX initiative, which supported by the World Health Organization, and also there are the Gavi Global Alliance for Vaccine and Immunization, Gavi Alliance, is supporting. Then there is another group called Coalition for Vaccine for Innovation, right? Mm-hmm. So that group, these three groups have together, and then they have created this COVAX facility.
Right.
And it is trying to provide vaccines for all the countries, whether rich or poor.
Right.
So that facility has announced, and we have requested from the COVAX facility that we have registered with the COVAX facility. So therefore that we are to get some 20% of the population vaccine free through this COVAX facility.
Right.
So very soon, once the vaccines are registered with this COVAX facility, when it is available, the COVAX facility will start, allocating vaccines for the countries. Mm-hmm. And there are different mechanisms, and one mechanism called advanced marketing mechanism. So that mechanism, AMC, that have registered 92 countries of low and middle income countries. So under that, we are getting this 20% of for 20% of population, the mm-hmm. vaccine requirement, that is 4.2 million population will be covered. Is
that enough, having 4.2 million? Is that enough to stop the spread in Sri Lanka?
No, not really. We have to look for, other ways to get vaccine for the other.
So how many, out of a population of 21 million, how much would be the minimum best figure?
We need to reach at least more than 50 mean, if we reach more than 50, of course, then we will
More
see
than
50% coverage.
Over 50%.
Yes.
Then what would happen? How does that?
We have to continue this, what we are continuing now, like using the face mask, hand washing, and keeping the distance.
Yeah.
That we have to continue. And then while continuing that, we can really start vaccinating with the available vaccine, so that this vaccine's utilization is for above 16 population. So we can start vaccinating, and then probably perhaps there will be other vaccines in the market which can be used for the kids in the future, so that once it is available, perhaps we can go for the vaccinating children.
I see. And what of the cost factor?
Actually, for the moment, this vaccine now only the COVAX facility, the registration has received by the Pfizer vaccine. So there will be other vaccines which are on development will join this COVAX facility. So once it is joined, this the vaccines are available in the market, perhaps the vaccine cost will come down. And Gavi will be, or this COVAX facility will be fixing a price for this vaccine. So the producers, manufacturers will provide vaccines to the COVAX facility.
Right.
And then once this 20% free comes to the whole world, the vaccine cost will really go down, because I mean there will be a competition, demand with the other vaccines coming to the market.
Now, sorry, go on.
Yeah, we have 60 vaccines at the moment at the clinical stages, and 172 vaccines in the preclinical stages by 29th of December.
Where?
I mean, the various
all
countries
over
are all over
yeah.
the world.
Okay.
All over the world. So not all these vaccines will complete their story.
Yeah.
So there will be at least a number of vaccines that complete the whole trial. So once completed, they will be registered, and then there is a facility called WHO is supporting this whole mechanism, and therefore that they have this earlier. WHO was having a process called pre-qualification of vaccine, but now there is this process called emergency use list. So now only the Pfizer vaccine being included in this list so far, but I am sure that the other vaccines, once they will apply to the WHO to register, and it will be available for the countries to use.
I see. Now then, the Pfizer vaccine has you need to store it in temperatures of minus 70.
Yes.
Clearly, does Sri Lanka have such a facility?
No, not at the moment.
No. So then that for practical reasons, that vaccine will be sort of discounted here in Sri Lanka.
Yeah, I mean, at this particular point of time, we can't think of bringing Pfizer vaccine because of for the government sector. Perhaps private sector may have the facilities.
Do you foresee a situation where the government will say, right, well, we'll do all the four. There's Pfizer, there's Moderna, there's Astrazeneca, and there's one or two or even more than that. Do you think that the government in the end might agree to say, right, you can have all the vaccines as long as they're being cleared abroad?
It all depends for us, because we have a system established in the country to register vaccines, right? Now there is a committee called Advisory Committee on Communicable Diseases, where the epidemiology unit of the Ministry of Health is really the organizing this committee, and the Director General of Health Services is the chair of this committee. So this committee deliberate on the vaccine safety, the efficacy, and then the risk management plan, and overall quality of the vaccine when the vaccine information is available. So, and then there is this NMRA, that's National Medicinal Drug Regulatory Authority. So then any vaccine has to be registered in the NMRA. So there is a process there.
Even if it comes from outside?
Yeah. Any vaccine which comes to the country, before it is being used in the country, it has to be registered at the NMRA. So once they review and register, and then they will communicate it with the advisory committee on communicable disease, and then advisory committee on communicable disease, based on the facts, it will agree or disagree. So that discussion will be taking place, and then once agree, it is registered in the country and ready to use. So any vaccine has to follow that process in the country. Of course, I mean, it is the government responsibility how it should be managed, but this is the process that we have been followed as technical people throughout the history.
I see. And so is it very likely in when you estimate all these things that it will be the vaccine, the Astrazeneca one that is going to be manufactured or is being manufactured in India, that will be the one of choice for Sri Lanka?
India, or whether it is in Belgium or any other European country where the Astrazeneca is manufactured, for the moment, I mean, because it is the, I mean, in the forefront where it can be kept this 2 to 8 degree centigrade
That's the key
storage.
here.
That's the key here, because we should be able to store it within the country. So all other vaccines we are managing with this 2 to 8 degree centigrade storage capacity. So we need something that which can be stored in the country for the government sector. So for the moment it is AstraZeneca, but we need to by the time that AstraZeneca get into this vaccine emergency use list in the WHO, perhaps it will be late January or early February. So by that time, that I mean, that if everything is okay, I am sure that perhaps that will be the vaccine that most probably will be Sri Lanka will be getting.
And it's in your view, when this requirement of storing between 2 and 8, that is available right throughout our country. And we have the necessary mechanism to administer the vaccine.
We have, I mean, in the history, we have had mass campaigns for many vaccines, and so therefore that the capacity and the know-how is with our technical people and epidemiology unit, the Family Health Bureau, and there are other agencies in the Ministry of Health which mobilize the health teams, and perhaps, I mean, it is, I mean, it's a matter of time that we organize. So for the moment, the epidemiology unit of Ministry of Health is now, they are preparing the vaccine deployment plan. So we will be discussing on Monday the draft. So therefore that probably, I mean, we are ready, we are getting ready for that.
You are getting ready. Let's ask Dr. Nihal Abeysinghe further questions on the state of preparedness of Sri Lanka after this short break. Don't go away. After all, this is Newsline Live.
News First, Newsline with Faraz Shauketaly.
And welcome back to Newsline Live, and I'm in conversation with Dr. Nihal Abeysinghe. Dr. Abeysinghe, just before I ask you some other questions, we have various questions from our viewership. One is, of course, a question that I too would have like to ask, and that is the importation of the vaccine. Will that be a government-only initiative, or is there going to be a tender called, or how does it work?
So far, I mean, what we know is that, you know, that this COVAX facility support will come to the government, and government has to decide whether they will be make it available in the private sector or not. And I know that NMRA, National Medicinal Drug Regulatory Authority, they are now reviewing the vaccines available.
So who would actually import the vaccine? Would that be the government? Or
manufacturers, you know, I mean, and then they should have their suppliers here in the country.
So the choice of which vaccine will be made not by a tender process but by the government?
It has to be, you know, I mean, we need to get the information first, and the NMRA will review those information. It will look at the efficacy, the safety, that risk management plan, all that, and then register. At the process of the registration, that we need to look all these requirements. So once it is registered, now it will be ready to bring to the country.
Right.
So that process, perhaps it will be just like any other vaccine process. There will be suppliers.
The other vaccines, forget
Yes.
this one for the moment,
Yeah.
the other vaccines, how is the procurement made? Is that by a tender process?
Yes, it will be, if it is, if the government is going to buy it, there will be a tender process. But if in the private sector, perhaps, the routine mechanism that they will use.
Right, but how essential is it for the government to administer this whole thing, to manage it?
Because, majority of Sri Lankans probably will not be able to buy this from the private sector. So the government has to have, and also all the other vaccines so far, the childhood vaccination is done by the government sector.
As a citizen of Sri Lanka, as citizen Abeysinghe, would you welcome a move supported by the government that encourages those who can afford it to pay for their own vaccination, so that the government ones can then, so the government net, if you like, can be expanded?
So if the government can have a plan, now government is getting 20% population a free vaccine.
Which is only 4.2 million.
Yes. So the rest government has to buy.
Yeah.
So government has to decide how the government is going to buy that vaccine, whether it allows to the private sector or not, right? So maybe, once that decision is made, perhaps, the rest of the, the issues will come.
What are the risks involved in all this?
First, we need to make sure that these any vaccines which are brought to the country are the efficacious as well as safe. If the safety is assured, there won't be any issue other than that, efficacy.
And who will ensure the safety? Is that the NMRA?
NMRA and the Advisory Committee on Communicable Diseases. We have to go through the dossier and see, and then we have to get the experience from the other countries. By the time that the vaccine comes to Sri Lanka, other countries would have introduced and used a large number of, they would have vaccinated many people outside Sri
For the
Lanka.
last so many minutes, while listening to you, what appears foremost in all of this discussion is the level of attention being paid to professionalism. And in that context, can I ask you, what of these local, call them concoctions or local theories, what about them?
You mean
in terms of, I'm telling you about these various pennies and all sorts of other things.
See, it's very difficult for me to comment because I do not know exactly what these are.
Yeah.
So unless some group or some...
How long have you been a medical man? Yeah.
I qualified in 1981 December.
So since 1981, have you ever heard of a local vaccine for anything?
Yes, we had.
Which is what?
We had for typhoid.
Okay.
Local vaccines long ago, but we abandoned the production of it because we was using a very old method, and most of the countries abandoned that production style. So now we have newer vaccines and quality vaccines. So it's almost now all the vaccines are coming from abroad, and we are buying vaccines. We don't produce vaccines here.
I see. And you are hopeful. Are you slightly concerned that the organization or the planning process is doesn't appear to be, to me anyway, as a member of the public, doesn't appear to be up there? And are you concerned, and if so, why?
For us, the discussions are on,
right,
and the technical people are looking at this information, but perhaps what is lacking is how this being communicated to the public.
Yeah.
That may be the reason, because everybody knows now this COVAX facility is giving all the countries this 20% free vaccine.
A very important question has come up.
Yes.
And which is, what is the methodology that's going to be used to distribute this vaccine to whom? Who's in the pecking list?
Okay, actually when Sri Lanka submitted its application to the COVAX the initiative, Sri Lanka had to identify what the priority groups are. So above 60, the elderly population, and the people who have non-communicable disease, we call in our terminology comorbid people, they have various non-communicable disease like hypertension, diabetes, cancers, and so but they are reasonably healthy, and that category, and the frontline workers, the health workers, and the the forces where they have involved in the prevention and control measures. So those three categories that Sri Lanka has prioritized.
So that would be the priority.
Yes,
in the use of this 4 million.
Yeah, depending on the time that the committee will have a relook about this.
Who will be in the driving seat?
As I said earlier, we have an advisory committee on communicable disease. We will be looking at this the needs.
The reason I asked you that is my follow-up question
yes.
is, what chances of politicizing even that?
Unlikely.
Unlikely.
Because we have already made our application to the COVAX facility.
Right. And the rest will have to fund it somehow.
Yes.
When you look at all these different vaccines, you already said that we don't have the facility to store at -70, the Pfizer one. So out of the rest then, is the Oxford vaccine the best?
See, what is available at the moment with the registration, and countries are now using these vaccines.
Yeah.
So therefore we can get information on the vaccine usage. So we will be shortly know that how safe these vaccines are. So therefore that based on that available information, we can make the decision. So what vaccine we should be going. For the moment, it is Astrazeneca, which really suit the conditions.
And who will actually administer it? Who will do it? Are they trained paramedics, nurses, doctors?
We do have. We do have the health staff, these public health midwives, and nursing staff. So they will be the people who will be administering vaccine.
And their expertise is adequate.
They have been doing this for years, so they should be able to do.
So we're confident on that
yes,
score.
Yes, certainly. Yes.
Dr. Nihal Abeysinghe, thank you very much for being on Newsline Live. We appreciate your input, and that's the way it was on Newsline Live this evening. Time now for the primetime news from News First. Take care. Have a great evening ahead of you, and do remember that after the primetime news, it's Face the Nation on TV1. Take care, and as always, God bless you.